Thank you for joining us for our monthly Instagram Live series, Ask Anthros. I'm Diana. I will be your host today. So we have a big topic today. We are going to talk about workplace vaccination mandates. I'm sure by now you probably have heard that on September 9th, President Biden announced expanded vaccination and testing mandates for employers. There's three groups that these mandates apply to: federal employees, healthcare workers, and private employers with 100 or more employees. In total, that's about 100 million employees that these mandates will apply to. That's about 2/3 of the employees in the United States. The biggest piece of this is definitely that last group, private employers with 100 or more employees. That alone is going to apply to 80 million employees, and that's primarily what we're going to talk about in today's episode. We have a lot to cover. You can see all of my notes here, so I'm going to dive right in. If you have any questions, feel free to leave those in the comments, or even if you're watching later and have a question, feel free to reach out to us on social media or get in touch with us through the contact form on our website, and we definitely can get back to you. All right, let's get started. So, as I said, private employers with 100 or more employees must require that their employees either get vaccinated or show a negative test result before coming to work each week. So this requirement is going to be implemented through the Occupational Safety and Health Administration, or OSHA. So Biden directed OSHA to come up with an emergency temporary standard, or ETS. What is an ETS? So that's something that allows OSHA to address something that is considered a grave danger to workers, so they can put out a rule that addresses that immediately. Once an ETS is released, that can stay in place for 6 months, and at that point OSHA has to release a permanent OSHA standard, and then there's a formal process that goes through. There's a notice and comment period. So when do we expect that this ETS is going to be released? We really don't know. OSHA officials have said publicly that it will be a matter of weeks. What that means, we don't really know. But keep in mind that once it's released, there probably is going to be an implementation period for this before OSHA actually begins enforcing the mandates. So, maybe that's 75 days, maybe that's 90 days. We'll have to wait and see and find out. But we're already basically in October, so we're probably looking at next year before these mandates really go into effect. But keep in mind, the more employees that you can get vaccinated now, the easier it's going to be for you when these mandates do actually go into effect. Is this going to be challenged in court? Yes, 100% certainty it will be challenged in court. Arizona has already filed a lawsuit against the Biden administration, and 20 other states have said that they're going to do the same thing. So we'll really have to just wait and see how that unfolds. Will courts think that, COVID is a grave danger and that OSHA has the authority to release this emergency temporary standard? We'll kind of just have to wait and see how that all plays out. But one thing to keep in mind, even if there is a successful challenge, that's something that, may not come about until after this temporary standard has already been released. So employers need to prepare now. They need to expect that they will have to comply with this. Let me talk about the threshold of 100 employees. When the ETS does come out, we'll get some more details about how OSHA is going to define this. They have said in public statements that the 100 employee count will apply to your entire company, that it's not by location, meaning if you have 100 employees that work for you nationwide, you should expect that you will be covered by this mandate. Part-time and temporary employees, we don't exactly know what the ETS will say about that, but you should assume that those are going to be counted towards the threshold. Another question, what if an employer, has fluctuated above and below 100 employees? What happens then? Probably the ETS is going to be written so that, you can't just fire 5 employees and then the mandate won't apply to you. So maybe it'll be something like if you've had 100 or more employees at any time in the past year, that this mandate will apply to you. And that is our recommendation to you, that if you have had 100 employees at any time in the past year, that you should expect that you'll be covered and begin preparing now. We're going to talk a little bit about what that looks like in a minute. Briefly, I want to touch on the other mandates that were announced. I don't want to spend too much time on these. Federal employees and contractors. So this actually was implemented through an executive order that Biden did sign on September 9th that requires almost all federal workers to get the COVID vaccination. So this only applies to the executive branch, not judicial or legislative, but all federal agencies fall under the executive branch and will have to comply with this executive order. Interestingly, this applies to remote workers as well. They're going to have to get vaccinated, and it has eliminated the option for employees to get tested weekly. So it is a mandate for employees to get vaccinated, and the deadline for federal employees is going to be November 22nd. It also is going to apply to federal contractors and subcontractors, and their deadline is going to be December 8th. And there are some additional details about this, the size of your contract. There's some other workplace safety protocols that contractors are going to have to be in compliance with. So if this is something that does apply to you, you're going to want to go check out the document that was published by the Safer Federal Workforce Task Force that came out on September 24th. So go check that out to make sure you know what's coming and what you need to do to be in compliance. So this other group, healthcare workers. So employees at all healthcare facilities that participate in Medicare or Medicaid programs will have to be vaccinated. So this means hospitals, clinics, other healthcare offices. Pretty much this is going to mean in effect that all healthcare workers need to be vaccinated. This is going to cover nursing home staff, hospital staff, clinical staff. It's also going to apply to employees who are not involved in direct patient care. Right now, we are waiting for the Centers for Medicare and Medicaid Services to develop and release an interim rule on that. And that is going to provide a lot more details about this mandate for healthcare workers. So we're also going to kind of have to wait and see a little bit where that mandate is concerned, so stay tuned. All right, I'm going to get back to talking about the vaccination and testing mandate for employers with 100 or more employees. So another element of this that has been announced is that these employers are also going to have to provide paid time off to employees to get vaccinated or to recover from the vaccine. The ETS definitely is going to explain this more for us, but OSHA officials, from what they've said, it sounds like they're not going to require employers to provide additional PTO, that they can require employees to use hours that they have from their existing and current PTO plan. We don't know yet what will happen in cases where an employer doesn't offer a PTO plan, or maybe where an employee has already exhausted the PTO under their current plan. So those are some questions that we'll have to wait and see what the ETS says about them. One more thing that also has been announced is the penalty. OSHA has said, or it was announced, that it will be $14,000 per violation for employers who don't comply with the vaccine and testing mandate or with the paid time off requirement. Does this penalty apply to each work site? We don't really know, but it probably will be something like the penalty is per work site that is not in compliance with the mandate. So that's another question that we will need to get answered from the emergency temporary standards. So, in the meantime, while we wait for this to be released by OSHA, there are a lot of things that employers can do to prepare now. And we strongly recommend that if you are going to be covered by this mandate, that you do take steps to get prepared now. So where should you start? So there's kind of two routes that employers can take when it comes to the vaccine and testing mandates. So, The first route is that you can implement a mandatory vaccine policy with no testing option. So just kind of across the board require that all employees get the COVID vaccine. And then the only exemptions to this would be those that are required under law for, sincerely held religious beliefs or for disabilities. We'll talk about that a little bit in a minute. So that's one route, to do the mandatory vaccine policy. Or two, you can allow employees that are not vaccinated to present a negative test every week and not require that employees get vaccinated. So how do you decide about, which of these routes is best for you? I want to talk a little bit about the testing option. I know definitely some employers out there are reluctant to put a mandatory vaccination policy in place. We understand. However, if you're going to be required to collect weekly tests from employees, I kind of want to talk that through, because from an administrative and a logistical perspective, that weekly testing option probably will end up being more of a burden for you. So you want to make sure you've figured that out and thought through what that process is going to look like. So if you are going to allow employees to get tested weekly, you are going to have to establish a process for collecting and tracking that information every week from employees. What documentation are you going to ask for? How will employees submit this? Who will they give it to? And then also, test results are considered confidential medical information, so you will really need to limit who has access to this information. These results must be kept separately from the employee's personnel file. Just like other confidential medical information, those need to be stored in a separate file. And then if someone one week does not provide a test, they cannot be at work until they provide it. So you'll have to send that employee home and really develop what your plan for responding to violations will be. You're going to want to take corrective action. So you'll have to sort of lay out what your corrective action plan will look like when an employee violates this and doesn't produce a test, 1 week. And it's going to be really important that you enforce this uniformly. You can't look the other way if one employee doesn't bring in their test one day when they're supposed to. And I also think for the testing route, that training is going to be really important. Training your managers, in the process, and also training them in how to respond when there is a violation. I think that is going to be really important. There's definitely a lot of things that we are waiting to get clarification on when the emergency temporary standard comes out. We don't know who will be responsible for paying for these tests. Will it be the employees? Will it be the employer? In a lot of states, if you require an employee to get a medical test, you have to pay for that for your employees. Will you have to pay non-exempt employees for the time spent getting the test? Is that considered work hours? That's another question that we don't know the answer to yet. So when you're thinking about if you want to go this route and allow testing, or go the mandatory vaccination route, what should you really be thinking about? So keep in mind, the more employees you have that are not vaccinated, the greater the burden will be on you if you go the testing route. So you may want to just start by surveying your employees and sort of, see where they at, what percentage of your employees have already been vaccinated. If it turns out that there's just a handful that haven't been vaccinated, the testing route's definitely a good way to go. The logistics probably will not be too overwhelming to collect those weekly tests from employees. Another thing to think about is accessibility to testing. Is it going to be something that you can reasonably ask employees to do every week, to go and get tested and provide those results to you? And that really might depend upon where you are. Here in Orange County, in Florida, we have good county testing sites that are easy, convenient, and free. So for us, there is testing that's accessible, but that is definitely not the case in all locations. And then also another question that we want more information on is testing types. Is the ETS going to say that all testing types will be covered? We have the rapid tests, we have the PCR tests, And it's, it's probably likely that the ETS will allow both employees to get either of these tests, but then, it'll be up to you as an employer to decide, do you want to allow both employees to submit both of these tests? We do know that the PCR tests are a little bit more accurate, especially when it comes to asymptomatic cases, but then there is a couple day wait on those. So, are you going to allow employees to do both of the tests? And then, we also have the at-home tests that are available. And another thing that Biden had announced is that he wants to expand access to at-home tests, and that big retailers like Walmart and Amazon are going to offer these home test kits at cost. So, the ETS may say that it is totally fine for employees to do these home test kits and that those results are fine. But, do you want employees to be doing these tests at home and then submitting the results to you? Is that something that you would trust your employees to do? Or is it something that you want to be administered in the workplace, and have someone responsible for administering and collecting those results at your work location? So those are some other questions to think about when it comes to testing. And while we wait for the ETS to come out, it's you should probably start brainstorming about which approach and route that you are going to want to take, because you'll need to make these decisions and then get them down in writing after the ETS comes out. So let's talk a little bit about what the mandatory vaccination policy will look like if you want to do that and not allow testing opt-outs. So you'll still have to develop a documentation process. What proof of vaccination are you going to be requesting? The ETS may have some specific details about this. The one good thing about the mandatory route is that once you collect this information once and then you're done, but you still will need to have that process in place. These, again, are considered, confidential medical records that will have to be stored separately from the employee's regular personnel file. And then also for mandatory policies, you also will have to be familiar with the accommodations process. So to be in compliance with the Americans with Disabilities Act and with Title VII of the Civil Rights Act, you have to make accommodations to employees for two reasons. One, if an employee has a disability or medical condition that prevents them from getting the vaccine, or two, if the employee has sincerely held religious beliefs that are inconsistent with vaccination. And you will need to create a process for employees to request accommodation for these two reasons. So what does that process look like? Probably you will want some kind of accommodation form that employees can submit to their HR department or other designated point person at their company. And you want to make sure to really communicate this process to employees anytime you mention or put in writing that you have a mandatory vaccination policy, whether it's in, a job posting, a job description, in a memo or email to employees, and you're telling employees we have this mandatory vaccination policy in place. You also want to mention you will be allowing accommodations as required under law. If the request is for medical reasons, the employee will have to get documentation from a medical provider that, one, shares the medical reason or impairment that prevents the employee from getting the vaccine, and two, also says how long the employee will need this accommodation for. Is it a temporary thing? Is it permanent? The medical provider will have to explain that question as well. And then if it's for religious reasons, the employee has to explain why their religious beliefs are inconsistent with getting vaccinated. You are allowed to ask employees for supporting documentation. That might mean a statement from a religious leader, for example. You don't have to do this though, and you would maybe only want to do this if you have some evidence that the employee's religious beliefs are not sincerely held. So next step, so once an employee requests an accommodation, completes the form, then the employer reviews the case to see if the request is legitimate, is covered under the ADA or Title VII of the Civil Rights Act. So, if it's an ADA accommodation, not all medical conditions, will be covered. If someone has a broken leg, like that is probably, not going to be a legitimate medical condition that prevents someone from getting the vaccine. And the thing with accommodations is you really have to evaluate them on a case-by-case basis to see if they're legitimate and covered under the law. If it's for religious reasons, we recommend that you assume that the religious beliefs and practices described by the employee are real, are sincere. Only if you do have evidence that the explanation is not sincere, then you would maybe want to ask for some supporting documentation. And then if you do end up granting an exemption to your policy to an employee for one of these reasons, then the employee will need to do the weekly testing, will need to wear a mask in the workplace. One thing, the law says that you don't need to grant an accommodation if it is an undue hardship to the company, but it is pretty hard to prove this, and we don't recommend that you try to go down this route. If an employee can still do their job while wearing a mask and getting tested weekly, then it would be pretty hard to prove that it's an undue hardship to provide this accommodation. For Anthros clients, one thing to keep in mind is that we will help you review these accommodation requests on a case-by-case basis, and we do have the forms that we can provide to you, because every case is different, and you will have to look at each case and determine, is this covered under the law, and then have an interactive dialogue with that employee to determine if an exemption is going to be granted. So that's something that Anthros will talk clients through. So keep that in mind. And then really the last thing that I wanted to mention and encourage employers to do is that you want to start working on your employee communications. Your success in implementing this policy, as with implementing all policies, really will hinge upon how well you communicate it to employees. If you know now that you are going to be covered under these mandates, we really encourage you to communicate to employees right now, to not delay. It is totally okay if your policies are not in place yet, if you haven't developed those. Obviously, we're waiting to see what the ETS says, what the details and requirements actually will be. But you can still go ahead, let your employees know, this mandate is coming. We will be covered under it. We will have to comply with it, so get ready. Like I said earlier, the more employees that you can get vaccinated now, the easier it will be for you when this mandate does go into effect. So anything you can do to create a sense of urgency and encourage your employees to get vaccinated, provide as much information as you can. Tell employees exactly where they can go to get that vaccine. If you're able to provide paid time off to employees to get vaccinated, that also helps encourage employees to go do this. But basically, communicating frequently with your employees, being transparent, letting them know in a timely manner, that's all going to really go a long way towards building trust with your employees. And you're really going to need that for these mandates, to be successful. Will employees leave when these mandates go into effect? That's something that we will have to wait and see. One good thing is that a lot of big companies have already put mandatory vaccine mandates into place, so we can kind of wait and see how that plays out now before these new mandates for employers go into effect. So we'll kind of have to watch and see what happens with that. I'm going to wrap up there. I know that we've covered a lot. I hope that this has been helpful. Obviously, there's a lot we still don't know. We are waiting for that emergency temporary standard to come out. As soon as we, get that and are able to read it, we are going to provide more information for you on our blog. So, stay tuned. Keep an eye on our blog that's located on our website at anthrosinc.com. We'll also, talk about it on social media as well. So just, stay tuned and look for future communications about that. And again, if you have any questions about this or about any other compliance matter, definitely reach out to us. We've got a contact form on our website. You can reach out to us through our social media channels. And thank you so much for joining us. And if you have any questions about compliance, definitely go check out our blog, as I mentioned, and stay tuned for announcements about what our next episode of Ask Anthros is going to be. Thank you.